Well, good afternoon and good morning to everyone, and thank you for tuning in to our short website this afternoon on strategies for reversing out-migration. This is Terrell Eisinger. I'm lucky to be the National Organization of State Offices of Rural Health Executive Director. And just a couple of words about that. It is the 50 state offices of rural health who first had a vision for National Rural Health Day, and we're very happy to be celebrating the 25th anniversary of the Federal Office of Rural Health Policy State Office of Rural Health program. We thank the state offices of rural health for the good work that they've done. National Rural Health Day is an important day to us. It is a time when we honor rural community leaders, we honor state offices of rural health, and we thank our sponsors and our partners who keep up the good work to improve rural health around the country every single day. Just a quick reminder for you about the website. You will be on mute, and we invite you to please use the chat feature in the upper left-hand corner of your screen to interact and send questions or comments to the speakers today. Today, we're really very honored to have two experts to talk to us about the importance of keeping rural patients in their community for the care that they deserve. And we know that Michelle Rathman is the President and CEO of Impact Communications to be an expert and a vital advocate to support rural hospitals around the nation. And we thank Michelle for the work that she's come alongside NOSOR to do to improve the visibility of National Rural Health Day this year. And you'll hear from her throughout this webinar. And join with Michelle is Stephen Tenhouse, who is the Chief Executive Officer with Kirby Medical Center in Monticello, Illinois. So to get right to the action, we'll turn this over to you, Michelle and Stephen, and thanks for being with us today.
Well, good morning and thank you. So that you hear my voice, I'm Michelle Rathman. And Steve, if you could chime in and let folks know who you are.
Yep. Good morning or good afternoon, everybody, depending on where you're at. Glad to be here.
Well, we are both really excited about this very quick and we hope to be informative and highly impactful session because out-migration is something that we know rural hospitals and practices and FQHCs, for that matter, struggle with across the U.S. in rural communities. And we think it's important, you know, we say we want to keep care local, and we really try to scratch our heads to figure out why people would leave their service area when they have quality care close to home. So we've been doing a lot of research over the past 15, 20 years about why out-migration happens. And as you'll see up on your screen, these are a number of reasons. They're not all the reasons, but they are really the top reasons why it happens. And it goes everywhere from the fact that patients have some challenges with respect to privacy, feeling that there's breaches of privacy. We know that that's a significant issue no matter how much we try. We know that that can be a challenge for close-knit communities. And we also know that you can't train individuals on the team to be nice and to train patient-centered care. We really have to develop that and practice it every day. And then what Steve's going to talk a lot about today as well is just the challenges that all rural hospitals are facing with respect to provider relations, recruitment, and retention. So what you see up here are just a fraction of the issues, but we do believe that these are the priority issues that we should be really focusing our attention on, because we take for granted that just because there's a rural hospital that patients are going to engage. And today there'll be another website focused on trying to attract a patient population that just simply is not interested in what you have to sell. And Steve and I really believe in the philosophy that they're not our patients, they're our stakeholders. And if we could really, as caregivers, and we don't really look at hospital employees as employees, we look at them as caregivers. We want them to really care about what they're giving to the stakeholders in their community. We have to look at our community members as people who cherish culture. They're winning battles against diseases and other things that are affecting their lives. They're working to enjoy their retirement, working towards that retirement and contributing in their jobs, and they're working to raise their families. So if we could not look at them as patients so much, that's the first step, is to really take a look at them as stakeholders instead. And one of the things that Steve will talk about next is really about building stakeholder groups. And we are, we kind of take the easy way out sometimes by looking at who are the usual suspects of community stakeholder groups that can help us with our out-migration challenges. Yes, we have to engage other service providers in healthcare. We do have to take a look at business leaders, but we have to go beyond the traditional comfort zone of just going to the Rotary group every week. We have to take a look at partnering with our education leaders, and that's beyond during sports physicals, at that time of the year. And we have to look beyond maybe just doing some of the work with our clergy with respect to delivering spiritual care in the hospital. So, Steve, I want you to just talk a little bit about stakeholder groups before we move on, and just talk about some of the stakeholder groups that you knew you had to engage when you were looking to build a replacement facility.
Sure. Well, the physician group was obviously the biggest, and our dynamic here is we had both a smaller employed physician group as well as a larger physician group that was actually, the physicians were employed by a large multi-specialty clinic that we were actually competing with on our own campus. So it was really an interesting process that we went through, because we're trying to engage these physicians in that larger group around building healthcare and advancing healthcare here in our community, when realistically one of their major goals was to try to pull business out of the community and into their larger multi-specialty group. So that was, one of our probably the first things that we contended with, and that didn't happen overnight. That took actually years. But at the same time, the other stakeholder groups, we realized that we had to engage with our employees. As Michelle said, they are our ambassadors. So we were working on improving our culture and helping to improve our brand along the way.
And so when we take a look at building stakeholder groups, in Steve's case, they were working to build a new facility, not because they wanted a shiny new toy, and because we know that their facility had a very limited useful life. It was an old, Steve, how many years, how old was the facility that you were in?
35 years old.
35 years old, landlocked in a neighborhood that had no opportunity for the campus to grow. And so one of the things that we really focused on was, when we are going out looking for stakeholder groups, let's find a way to make sure that as a part of the initiating conversation, we declare our strategic focus. While Kirby wasn't looking to be all things to all people, they really wanted to be, and this is a line that Kirby used a lot in their branding, is we want to be your connection to care. Even if we don't have the service, we want to make sure that we can concierge you to the right place, and that helps to bring a level of assurance that you will get people in your community to come back to your facility when it comes to those basic services that you can provide. And so with that, as Steve talked about, identifying these best target audiences and the opportunities to build relationships with people who get you, who understand what your mission is, looking for areas of mutual self-interest, while the competing practice was looking to be a part of the out-migration effort. There was some mutual self-interest. And one thing that Steve, has shared with me over the years is the self-interest was truly they wanted a healthier community. And that was a really interesting, place for them to land, and we'll introduce you to a program that really, served as a way, I would say it would be a conduit, wouldn't you, Steve? It was a kind of that olive branch that helped start you guys down the path of partnering on wellness versus looking at competing services. So the other things we take a look at is tapping into the strengths of your stakeholder groups and identifying what roadblocks might exist, responsive and intuitive tools and programs that are sustainable. Steve Tenhouse, of all the CEOs I've worked with, he really understood the measures of practicality. If we can't sustain it and support it, then we are not able to take it on, because he just knew that the bandwidth of the organization had to be responsible. They had to be responsible to take a look at what their capacity was. So, stakeholder groups. The things that we looked at with Kirby and that we look at all over the country when we work with hospitals, where do they exist? It's churches, it's civic groups, it's social gatherings, it's a grocery store. And we kind of chuckle sometimes when I say, what's the relationship you have with your grocery store? And people look at me kind of, bright-eyed, and they say, well, we buy stuff there. So there are ways for you to partner with the grocery stores. It's the beauty shops. It's your schools on a different level. And Steve, in a few minutes, will share what you guys did with the large-scale program we did to bring to the forefront the tragic issue that was happening in your community and surrounding communities with the use of pep spice and the abuse of synthetic drugs, and how you really worked hard to get the schools and to get the parents together to work with you guys on this, because it was impacting. So internal support. These are some of the things that we take a look at in terms of building the bridge between you and the people that are creating the gaps without migration. Internal support, sustainable programs, future growth, meaningful community relationships are a part of it. So how do we get there, right? We align our efforts with key strategic objectives. Steve went through an exercise of really understanding all the ways that they could serve the community. But Steve, can you talk a little bit about how important it was for you to make sure that they served your purposes as well? It wasn't about just kind of lying down and taking it. You really wanted to make sure those you engaged with, could be a part of the journey, and that included utilizing your services once your facility was built.
Yeah, it was one of those balancing acts, with the larger physician group. But what we found through the process was, as we were talking about our new building, we were obviously talking about the services that we provided and what we needed room for to provide that and more. And it was fascinating to talk to people, to hear them say, gosh, I didn't know you did that at Kirby Hospital at the time. So it wasn't just us, we found just talking about, what we intended, what we need to be doing in the future. We really had to re-educate a lot of the public about this is what we're doing right now. So while that could be frustrating, I had to view it as an opportunity, and again, a way to engage the people and get them more involved with what we're doing and have an interest in keeping their healthcare local.
And part of Steve's strategy was we weren't talking about the equipment they had, because nobody cares about how many slices your scanner is. Really, what they really wanted to understand is how the services that you can provide will really help improve the quality of their life. And so some other things that we take a look at on this journey as we're working towards out-migration is initiatives that will lock you in as the leader. And Steve's group and his community, there was two competing medical leadership groups. There was Kirby, and then there was the competing physician group. And it was really important for Steve and the leadership team and the board to really, it wasn't about winning, it was about really taking the appropriate place is the hospital. And it was so important that the hospital was seen as the leader, and with that all of the providers in the community were seen as integral team members, and that it was important to maintain that place. And then the other part we talk a lot about is caregiver engagement. Every hospital I work with struggles with caregivers being engaged. Punching in, doing the job and punching out. And so, Steve, could you talk just a little bit about Kirby Derby and what that did for your organization with respect to all hands on deck for that amazing annual event that you do?
Yeah, it's now actually be 10 years this spring. 11 years ago we had the idea. There used to be a big marathon race here in Monticello decades ago that went by the wayside, and we had an employee group we taken for a wellness walk up in Chicago. On the bus ride back, we're talking about, wouldn't it be nice if we brought a race back to Monticello? And that was where the Kirby Derby kind of blossomed out of. We held it over Kentucky Derby weekend, and it really got all of our staff involved in the process because you need a lot of volunteers, and it got them connected with the communities because they started talking with their churches about bringing groups out to help support the race. The local ham radio operators, the cheerleaders from the schools, the youth groups from the churches all came out to participate in this event, and it was the start of future collaborations where we realized that we can and do work very well together. It's a lot of fun, and it's all for a very good purpose. And we've gone from about 250 participants in year one to over 1,200 this past year.
I have yet to run. I'm a spectator, but you guys look like you're having fun out there. I say I run if someone's chasing me. So the next thing that we take a look at is really kind of the think, no, feel. And Carol is very familiar with my philosophy around this. Part about migration is combating community perception. And community perception, as we talked about in the earlier slide, I may not step one foot in your hospital to think something about it because it's something that someone told me. So when someone tells me something, hey, I think that's good or bad without having experience. So when we do community health perception assessments, not health needs assessments, that's left to another group, but the perceptions. So some of the perceptions we see, and if you sweep your social media and you see what people are saying about you, this is kind of a collection of the things that I've seen over the years. They don't offer the quality of care that I can find in a big city. The ER just, does a bunch of tests and they send you out anyway. They're just going to transfer you. They don't have a great reputation. One of the hospitals I've worked with, they said I wouldn't bring my dog there, or it's a Band-Aid station. And I was in a community a couple of weeks ago, and I happened to be having dinner, and I plant myself always in a place where I can, and people know me, I'm shy, I don't talk to anybody. And I was talking to these ladies, and they were talking about, the hospital, I haven't been there in years. And I said, why? And they said, well, I heard. And I said, well, how many years ago was that? They go, probably 10 years ago. So a 10-year perception, right, Steve? I mean, it can really do such significant and unfortunate damage. So we move from what people think to what they know, because I've experienced it myself. And part of that is community stakeholders who really believe in you, who say, you know what? What they've told you is wrong. I happen to have new information. Can I invite you to talk with the hospital CEO or one of the physicians or volunteers? And what we want to move them to is the desired mindset. I will be cared for. I will be safe. My physician, that whole team is invested in my well-being. And when I leave there, I feel so fortunate that they care about me. Even if the bill is high, they are willing to work with me and treat me with dignity and respect. So we're really looking to not train people and not to put ads out that say, hey, it's convenient and close to home. We want to bring you to this desired mindset, and that only happens through our efforts with our internal teams. And then as you see on the screen now, one of the things that I really admired about Steve is that he really embraced and understood the need to have a holistic strategic communications plan. So we invite you to not look at this as marketing, because many board members put their fingers in the air and they go, marketing, we don't need to spend money on marketing, it's, that type of thing. So we take a look at it as this marketing, social media, advertising, media relations, and fulfillment. And I will tell you, I just finished a 90-minute session, and I said, how many CEOs out there are afraid of social media, or better still, don't believe in social media? And I said, is it that you don't believe in social media like you don't believe in unicorns, or is it you don't believe that it works? So, Steve, talk a little bit about your commitment and what you have found this approach to do to help you with that community perception component.
this was one of the biggest changes that we made and has made one of the biggest differences. You know, an ad in the newspaper, a billboard, you know, sometimes that's a necessary function for your advertising, but I don't view it as marketing. I was a huge Mad Men fan when it was on, and I always liked the line of, if you don't like what you're hearing, change the conversation. And that's what we did, is we didn't so much talk about the services that we offered. We talked about what was going on around the hospital. We did that through Facebook. We did that through other social media outlets. We did that through events here at the hospital, whether it was fairs or wellness events. We changed the conversation, and it has made a huge difference for us. And we're not afraid of social media. We get our share of comments for people out there in social media, and our standard response is, we appreciate the feedback, and if there's an issue you'd like to discuss, please call us at this number. 99% of the time, you don't hear a word. And 90+% of the comments that are out there are all positive. So you have to be willing to, you know, to kind of take the anti-social media that happens through this. Sometimes you have to accept that, because the benefits on the other side far outweigh any of the negatives.
And at the end of the day, every single ad that Kirby has done, they speak the truth, and that the patient, Steve's quest, and we'll talk to that in just a moment, Steve's quest was, if we say it, we have to deliver it. So fulfillment is incredibly important. It has to be every caregiver, every shift, every patient, every time. I don't want to come into the hospital to receive care on your worst day. And so there's the external piece and the internal piece. But real quickly, in the time we have left, we just want to share with you some practical programs. This one, I'm elated to share with you because, again, it's just kind of it's a standout of what can be done. We all know that in our quest for improving population health, we've got to address the heart of these matters. And every rural community that I've ever worked with experiences obesity and all of the things that we know happens as a result. So, Steve, why don't you talk a little bit about this program and what it's done for you and how long it's running?
Yeah, this has now been going on for, I think, either 7 or 8 years, and it's a medical weight loss program that we started because we realized through our community health needs assessment that obesity was one of the main chronic illnesses that we had. We're a typical rural community. So this engaged our physicians in something, you know, outside, you know, of a typical chronic disease. More of one where, you know, kind of the stigma is, it's like, well, you know, they could lose weight if they wanted to, or that's their choice. And, you know, what this has done is it's given our community another entree into our organization to really change their life for the better, proactively. And what it's done is it has then morphed into much more than that, beyond just the medical weight loss side, but into medical nutrition therapy and improving eating habits long term, and now into the activity component, whether that's walking, running, CrossFit, any of the other programs that we offer. We're now connecting all of these things together, that regardless of where you may be on a continuum of your weight, there is a spot where you can enter that continuum at any point and move ahead. And it was very unique to the community. There are a number of these programs around now, but ours continues to be successful. We have very few people who have to come back on the program, and a lot of that has been over the last year our focus on, again, a long-term solution to lifestyle changes that need to happen.
And 3 quick points. It started from within. Kirby made a commitment that they weren't going to roll this out to the community externally until they rolled it out to their internal community. That was key. Secondly, there were patients who were being, that specialty group that we talked about, that they were going for bariatric surgery, and the competing practice didn't have this program. At the time, it was exclusive. They sent them, you heard me, they referred them to Kirby for this program, and those patients didn't end up having to have bariatric surgery. And thirdly, it generated revenues through the food products, through the labs, through the EKGs, so forth and so on. So it was a practice builder, a revenue generator, and it hit, you know, all those important key, that triple aim, if you will, to make sure that we're addressing population health.
Well,
So,
Michelle, if I can just jump in and add,
sure.
the other thing that it does is it brings people into the organization in a different way than they're used to. Instead of their first exposure being through the emergency department or having a sick family member in the hospital, this gets them involved in what's happening around the hospital and something that's very personal to them. And when you make a difference in your patients' lives, that's the glue that holds them to the organization.
Exactly. You know, to that point, we know that 85% of women age 40 and over make decisions for healthcare in their families. So when we talk about out-migration, women are our key demographic. So think about partnering with your local beauty shops and salons and teaching hairdressers and hairstylists about conversational prompts about wellness. We call this program Shop Talk, and the motto is show them you care about as much about their health as you do their hair. You want to engage those who also align with protecting and serving, starting a heart health program for local firefighters. These are real firefighters in Rincon, Georgia. You know, and we think about the idea of being able to make sure that we can address heart disease before it strikes. The number one killer of firefighters in this country is heart disease. Think about engaging seniors, those who rely on you more over the years, by engaging them through the grocery stores, a walking club, healthy recipes for them for diabetes prevention. School programs, as I told you about the big school program that Steve has done, including a hospital holiday card coloring contest where the kids color a hospital card for them, and then they put it into a six-pack and sell it in the gift shop. But it's a way to get kids focused on healthy behavior, drawing pictures about culture, community, family, and the season of giving. And then finally, the stakeholder group is being your caregivers. How do you make sure, and I really wanted to show this to you, we really work at promoting our doctors, and that's wonderful. But many of those don't live right in the heart of the community, the doctors. So we have to take a look at Kim Eggers, who's a plant manager, who's helping to keep the facility warm this winter, and Mindy Garfoot, who's a nurse who's caring for the community she grew up in. And then eventually, really, if you want to engage your community, engage community leaders and moms and dads, and be a part of your advertising and marketing communications. Who you see on the screen, the superintendent of the local schools. You see a mom who was going to deliver her baby elsewhere but couldn't imagine going somewhere else, and a woman who is a big part of a volunteer society who's having her rehab work there. So think about having them be your spokespeople to help you with your migration effort. So in the end, we hope that through this short web session today that you can drive healthcare back home without a catchy tagline of convenient care close to home. Create a shared vision with all your key stakeholders. What do you want to accomplish together? Take your differences and make them your strengths. Have a strong position to adverse competition. Steve and I spent a lot of time strategizing about not how to drive the competition away. The goal always was, correct, Steve, to get them to be a partner with you, not to be an adversary.
Absolutely. Go ahead.
Go ahead, I'm sorry.
No, I would say that actually is what made the difference, is that rather than looking at it from a win-lose scenario, we kept approaching and saying this can be a win-win. We know we can't do everything within our organization. We need partners that we can refer on to and that we can trust are going to support us. And that's eventually what won the game for us.
So we hope that the little time that we've had, you've picked up a few new ideas, and certainly I know this will be available for you to take a look at as well. We'd be happy to answer any questions if there's time.
Let's see. I'm not seeing anything in the chat.
The slides will be made available on our website afterwards.
And I'm also happy to answer any direct questions anybody has. Anybody has a question later on, feel free to reach out to me through this broadcast, and I'm happy to help.
Thank you, Stephen and Michelle. You all have done a great job of sharing your experience and your expertise with us. I know that you spoke about it very quickly, but that it's been a long collaborative effort that you've undertaken together. So thank you for sharing that experience. And just like the work that Michelle and Steve shared today, we know that the work to improve rural health is important, not just today, but but every single day. And Michelle has helped NoSOR to develop a pledge. We're asking you to take on this work all year long and to make a pledge to do that. And she's produced a video to tell you more about that and how you can make a commitment to this work every single day to stay connected. So we'll play that video for you now. Thanks to both you and Steve, Michelle.
Thank you.
Thank you for joining us in celebrating the power of rural. My name is Michelle Rathman, President of Impact Communications, and it has been an honor to work with the National Organization of State Offices of Rural Health to increase the outreach and awareness of National Rural Health Day 2016. As a part of our efforts, we've helped to develop the Pledge to Partner. It is now my pleasure to introduce this important initiative to all of you. The Pledge is a way for us to transform National Rural Health Day into a year-long, ongoing commitment to bring collective focus to specific healthcare issues facing rural communities across the United States. We're asking you to begin new conversations about the power of pioneering partnerships, and we need all rural health stakeholders to inspire communities across the country to address and resolve their most challenging population health issues. The Pledge to Partner focuses on 4 key areas, and these are: first, innovation. Commit to developing ideas, programs, and models that continue to transform and positively impact rural healthcare delivery. Challenge partners and community leaders alike to explore new approaches to reach at-risk rural populations, and engage thought partners from non-healthcare industries to help create additional solutions to prevailing health challenges. The next area of the pledge is focused on education. Initiate frequent discussions designed to inform stakeholders about the real issues facing rural providers. Inform those entering the field of medicine about the great and fulfilling opportunities to care for rural communities, and share facts and information about the needs to improve access and outcomes with those who influence policy and the allocation of resources. The next area of the pledge is about collaboration. Commit to forging new relationships that will bring additional resources into the rural healthcare fold. Please invite competitors to become those thought partners, helping to find synergies that result in achieving important shared goals, and then share ideas and resources and information with industry and non-industry contacts, seeking ways to work together in the common interest of rural health and wellness. The last piece of the pledge is all about communications. Use all available channels and mediums to spread the word about the power of rural. Follow, like, forward, post, and pin those stories and ideas and facts and opportunities and partner with all of those who are working to make a difference in rural health care. We're also asking you to really stay connected with NoSOR and your state offices of rural health throughout the year and help us reach the goal of 1 million people in social media platforms leading up to National Rural Health Day 2017. So there you have it. The 4 major areas of the pledge is to innovate, educate, collaborate, and communicate. And it's very easy to take the pledge by visiting powerofrural.org. There's a very simple form for you to complete, and when you hit the send button, you'll start to receive information for the rest of 2016 and into 2017, leading up to National Rural Health Day 2017. And the last thing we're going to ask you to do is, in everything that you do today with social media, please use the hashtag #PowerOfRural. Thank you so much for the opportunity to be a part of National Rural Health Day 2016.
Thanks, everyone. You're going to see that pledge pop right up. Michelle and Steve, thanks again. Happy National Rural Health Day.